Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about the opioid poisoning and likely measures for harm reductions, community based. Yes, for this I now welcome our expertise, who is none other Dr. Sravani, our senior consultant and head emergency from Somajigoda unit, Yashoda hospitals. I welcome you, ma'am.
Thank you, Shanti.
Yes, and thanks for your valuable time as well. And I also request all the speakers to introduce themselves. I start with Reshmi. Sorry, Princy. Yeah, over to you, Princy.
Hello everyone, good afternoon. I'm Princy Mathari. I'm a registered government nurse in Hyderabad. I have 15 years of experience in critical care unit in Hyderabad in various hospitals. Right now working in under government of Telangana. Today I'm very delighted to be part of this webinar and to discuss with the topic harm reduction in opioid poisoning with you all today. Thank you.
Thank you. Yes, let us also hear from Reshmi.
Hello, ma'am. Hello, everyone. I'm Reshmi. I'm a senior nurse in the emergency department in the Yashoda Hospital, High Tech City. I have been working here since 3.5 years, and I have finished my BSc nursing from Yashoda College itself. And it is an honor to be invited as a speaker for today's webinar. And thank you for giving me the opportunity.
So let us dive into the session and explore what we have in today's session. Yes, as you all know, India is a largest opium producer, and from prescription to illicit substances crisis affects one's well-being. So first insight we like to understand from Dr. Sravani ma'am, like are opioid-related overdose or self-harm statistics high, as you're the clinical HOD and you witness many cases. Yes, ma'am, over to you for your insight.
Yes, Shanti. Yes, definitely there is a strong evidence that self-harm and the suicidal behavior, which
Yes.
are significantly increased among the people who are using opioids,
Yes.
especially fentanyl and morphine overdose, especially those with opioid use disorders.
Yes.
Like currently, if you see in India, around 4 million people who are using opioids,
That's
and
a very
around 1
large
million
number.
people who are
Yes.
using opioids are dependent. And sometimes
Dependent.
even the simple opioid will not self-harm, but few factors like mental health problem, social factors lead to the addiction and lead to more self-harm.
Yes. Thank you for your productive insight, ma'am. And we also like to understand what's happening the other side. Like as Princy said, she has various, experience in different hospitals, and now she's with the government setup right now. And as we know, these drugs are all high risk medications. So, what is your policy like? Are these drugs kept or medications kept under lock with a double key? And
Yes.
or is it the inventory of pharmacy? Yes, over to you, Princy.
Now, usually it's from we keep it in a locker,
Yeah, yeah, yeah.
double locker. And
Yes.
whenever it's required, only the senior nurse manager is authorized
Yeah,
to give a drug.
yes. And yes, Princy, what is your practice? What is your
Yeah.
practice at your setup? Yeah,
Yes,
Princy.
yes. I've been working in NIMS previously, like I was a student there. So since then, I'm observing that all the opioid drugs are kept in the locker with a key. And the senior nurse, as Dr. Shavni ma'am explained, that the senior nurse is authorized to take the keys in order to prevent the over misuse of opioid drugs with the staff and also with the nurses also. Like if we give fentanyl with a prescribed dose, not more or not less. So
Yes.
senior nurse is there to take over and supervise regarding opioid medications in our hospital.
Yes.
And few staff also in our hospital, like few are like addicted with that medicine. So we keep under the locker.
Lock and key. And these are all controlled drugs because these are all high alert medications. Yes. I think, yes, Rashmi, you will also agree with the same that, this is not the inventory of our emergency, but it is procured from the pharmacy. Yes, Rashmi?
Yes, ma'am.
Yeah.
With the supervisions of our senior nurse, and the two members should be cross verifying before giving and while loading also. And we will take the signature from our ER HOD, and after that we'll go for taking from IP pharmacy. And
Yes. Yes, and every ampule has to be go into the documentation. We have a separate registered where every dosages are calibrated. Yes, so yes, going forward, like is opioids mainly used for medical reasons, ma'am? Like you're the right person to tell us whether it is only for the medical reason or dependency or what kind of clients we get to see. Yes, ma'am. Over to you.
So usually opioids are used not just to control the pain, it can be used even
Yes,
for control the diarrhea and even for the cough
yes,
suppression also.
yes.
But in an emergency department, if you see, for most of the acute pain management, severe ureteric alkali, pain not controlled with paracetamol NSAID, then when we go directly with either a tramadol. The opioids
Yes,
which we most commonly use in the department are a tramadol, and the higher level will be fentanyl,
fentanyl,
control the
yes,
pain. And sometimes a patient with a chronic pain, cancer patients,
yes,
severe unbearable pain, even in such kind of patients we use. And
yes,
few patients in reduction, like
yes,
to give a traction to reduce the limb, then we give a fentanyl as the local anesthesia also as the anesthetic agent. And during a as an induction during incubation also we can give fentanyl. And to control the diarrhea, short acting, because this opioids, no, they can give either in IV form or a oral form also.
oral form also, yeah,
So oral we don't basically use in the emergency department. IV form like tramadol, morphine is used for a severe pain, especially in the cardiac chest pain.
yes,
We use in
yes.
the cath labs that or in the cardiac ICUs. But in the emergency point of view, we most commonly use the tramadol and the fentanyl.
Yes.
So have you also likely, witnessed any case with a self-harm or overdosage, the client you have received is overdosage or a dependency, like yes, because this is a little interesting part and we wish to understand. Yes,
Yes,
ma'am.
I have received a 65 years old female who has taken a
Okay.
tablet consumption. It's an opioid overdose.
Opioids,
But
yeah.
we are not aware because initially she came alone without
Okay.
any attender. So when we
Okay.
were taking a history from the patient, she was very drowsy, like shallow breathing. I mean, not so
Yeah.
shallow. She was drowsy, little respiratory was bit low. The heart rate was around some 50, 55. She was
Mm.
just, it was looking like she was into deep sleep. She was just nodding, whatever we are telling. So
Okay.
suddenly the respiratory rate uh, fell to around less than 12. Then we
Okay.
had to intubate the patient, no attender available. Later, when we have seen, there were needle marks in the arm region.
Oh, oh,
Then
needle marks. Yeah.
and later, then we somehow found the attenders. And the attenders, when we started taking history, they told she has some psychological problems. She has some anxiety issues. She is on opioids. Then immediately we have given a injection called beautiful injection that is very short acting opioid antagonist that is naloxone.
Naloxone. Yeah.
As soon
Okay.
as we gave the injection, she quickly, to be frank, she
That's
opened eyes.
oh,
In fact,
that's
because
interesting.
she has
Yeah.
opened eyes, she was trying to communicate with us as she got incubated, she was not able to.
Yes.
And later
But she
again,
responded. She
but she
responded very
responded.
well.
When we started
Yeah.
asking her, did you take opioid overdose? She was saying yes. She was
Yes.
nodding. But the drug was very short acting. We need to give a repeated doses, and finally we started with the infusion. And good that within 26 hours to 28 hours, the patient fully became conscious, extubated, and sent home.
Yes.
So
So
this
that's how, yeah. So very great, the evidence-based clinical scenario. That's how I think we should connect and keep learning about the trends which is happening. Yes, thank you for the insight. And yes, Rashmi or Princy, have you witnessed any kind of overdosage or dependency or self-harm or, dependency? Yes. Over to you,
Yeah,
Princy, in short.
yeah, ma'am. Actually, I was working in a ICU. One
One
staff itself came to asking drugs regarding like fentanyl drug and Evil kind of tramadol even. She keep
Mm-hmm.
asking since many days. So we don't know
Yes.
why she's asking. We thought that she was asking for patients. But one day, so one of her friends or some colleagues told me that she's addicted to opioid drugs and should not give. So
Yes.
that one thing I've encountered.
Yes. I
And
think,
one
yes.
more
Yes.
question for Dr. Ma'am.
Yes,
Ma'am,
please.
the naloxone we give for opioid dependency. So how within how much time we can give naloxone and how we can give naloxone like IV, oral, or IM, like,
Basically, naloxone can be given IV, IM, subcutaneous, intranasally, and
Yes.
nasal spray. And sometimes we can give in the form of infusion also.
okay.
As it is very short acting, usually in the hospital we give IV or IM. Preferably it will be IV. If you don't get an IV access, then we can go with IM. So the dose here we can start with 0.4 to 2 mg. Maximum dose we can give up to 10 mg.
Okay.
And this subcutaneous and nasal spray you can use in the pre-hospital areas when we are receiving a patient by the paramedic. And this continuous infusion, obviously, as it is a short acting, till the drug is out of the circulation, we need to have a continuous infusion.
Continuous infusion. So
Yes.
after that, follow-up is needed for opioid dependent patients. Follow-up is there. Follow-up. After taking
Follow-up.
medication, drug came out from the body. After few months or few days, should the patient come to the hospital for re-checkup and
Yes, for a regular regular checkup is required. Usually from the circulation, it goes out within 24 hours,
Yes.
24 to
Oh,
48
yes.
hours.
so no
there is a
withdrawal
test.
symptoms. No withdrawal symptoms are seen in the patient after 2 or 3 days like that.
No, we do have.
We
Okay.
do. Yeah.
So we just need to follow up. Once everything is normal, then we discharge. So that is the
Okay.
reason after 1 week post discharge, we tell them to follow up.
Okay.
Yes.
Thank you.
And they always come back for the review with different specialties as well. Yes.
Yeah.
Yes. Now I think we have Miss Arundathi who has joined from Mehboob Nagar.
Yes.
She is nursing officer. Yes, Arundathi. Yeah, welcome to this webinar. Now the session is always on. And now, do you have any of your concern to be asked? Like now we were just discussing that
Yes.
these medications are also used like as a substance abuse or recreation also. Yes. Do you wish to ask anything from Dr. Shavni, madam?
Sravani, madam. Okay. Ma'am, good afternoon.
Good
I'm
afternoon.
Arundathi, nursing officer from Mahbub Nagar GGH Hospital. Ma'am, I'm very happy to be here and participating as a panel person here. Ma'am, I have one doubt. I had an experience like so many teenagers, they're taking this opioids. So, is there we are unable to find out that who is taking opioids and who is consuming, and because madam, easy early detection is better than the treatment and all the things. No, madam, that's what I have a one doubt. How to find the teenagers among teenagers who is taking the opioids?
So basically, in the teenagers, especially teenagers are most probably nowadays they are in a stress.
Yes. Yes.
So they feel the stressful and they start taking opioids. In the initial phase, it will be like control the pain because the opioid, whatever you take, it acts on the brain receptors and the spinal cord. So initial phase, it controls pain and same way it affects even on the dopamine. So that it feels the pleasure, happiness and all. So,
Yes.
and
Yeah.
later what they do is they're feeling more pleasure, they start taking it continuously. But over a period of time, no, it gets dependent.
Yes.
Okay.
Then to have a
Yes.
more pleasure, they started taking it overuse and it becomes a misuse. So early stage itself, for the teenagers especially, we should educate them. So either it
Yes.
starts from the house itself. And in
Yes.
the schoolings also, we should educate them, telling the importance of what exactly is a opioid, what is what happens,
Yes.
what is the importance, indications, contraindications, what happens if we misuse it.
Yes.
So if we explain them and what is the importance of the drug called naloxone, if we tell them, I think we can avoid all this. It's not just comes in a one day. We need proper training.
Coach and counsel.
Yes.
Yes. And I
Yes.
think every
Yes.
parents must also be very vigilant if at all they see a child's behavior which was very normal and child is behaving unusually, especially the teen group and very early adult
Yes.
group. Yes.
Yes.
Very
Yes.
interesting question you have quoted, Arundhati. Yes. So now we are going forward for the core fundamentals like how can nurses identify opioid consumption in
Okay.
patients visiting the ED? Like maybe the doctors are busy, maybe they are just busy intubating or a nurse who is there, triaging these cases. Yes. Rashmi, we like to
Yes, ma'am.
understand from you. Yes, Rashmi, and then
Ma'am,
we can,
excuse me.
yes. Rashmi, are you
Excuse me,
there?
ma'am.
Yes, ma'am.
Yeah.
Ma'am,
So what do you do if you, receive such cases? Yes.
Yeah, any age of the patient, ma'am, any age kind of patients, any patient entering to ED, like we triage the patient, ma'am. As soon as they reach to ER, we triage them, and like we assess quickly ABC, and we check the vitals as well. By that, we can see any if patient is having any respiratory distress like slow and absent breathing, or any opioid toxicity like confusion, conscious, the patient is conscious or not. By that only we can first easily visual how is the patient condition.
And also you
And
try to collect the information from the next of kin
yes,
or the one who
yes.
is accompanying the
If anyone
patient,
is
right?
accompanied and if they already know what patient has taken, it will be easy for us to give the treatment. Or else, at least we will be seeing the patient. If respiratory rate is more low and breathing is not properly breathed, we will be ventilate the patients until means for advanced airway, doctors will be doing that one. But before that, we will be giving the ventilation support, ma'am.
Yes,
And yeah,
as
One
rightly
thing,
said.
yeah,
Yes,
one thing I
Dr.
want
Shah.
to add on here.
Yes,
Basically,
please.
see, it is very challenging in the department because the
Yes,
OP poisoning and opioid overdose
opioids.
almost looks the same because
Yes,
Yeah.
both have a respiratory depression, both are unconscious or drowsy. So the only
yes.
difference here, and pupils have pinpointed in both.
yes,
The
Both,
only
both
difference
condition.
here will
Yes.
be the secretions. The OP
Oh,
poisoning, you have full
Secretion.
sweating all over the body. The
yes,
secretions
yes,
comes from the mouth, secretions from the lung, bronchoria, you
yes,
say. You have defecation, you have a fasciculations. It looks like a seizure. So if you have
yes.
extra all these symptoms, then you have to suspect it could be a OP poisoning.
Mhm.
Oh, that's a great, insight. Yes. So, yes, Arundhati, you wish to ask, and I think, yes.
Yes, ma'am.
Arundhati, are you there?
Yes,
Yeah.
yes, yes, yes.
What you wanted to ask? Yeah.
I want to ask. Actually, ma'am, I was clear about that. But when it is spreading like opioid consumption among the teenagers is spreading like then, and they are admitting in the hospitals also. Okay, ma'am. Only we know that only that person is going to be unconscious, and the history we are unable to take history properly. Physical examination only it is there. But in the teenagers, what happened? They're admitting in the hospital. When they're admitting means how to take that whether they consumed opioid or not, were under the opioids and addiction or not, and how to find out what physical examination it will give us clear picture about the opioid addictors.
See,
Yeah.
in clinical examination, you don't have anything specific. See, when
Yes.
Okay,
you receive a teenager, come for the admission, history,
okay,
basically you ask them, are you on any other medications previously? You have any anxiety? You have any stress related issues? And you
okay,
have to even ask the time period, whether
Yes.
they are
okay,
in a short or a long time. If they are long duration using any opioids or any substance
okay.
abuse, it means that obviously they are into overdose.
Yes, ma'am. Yes,
The
ma'am.
next way, along with taking the history, you even take a history from the patient attenders also, the family members.
Yes, ma'am.
And thorough physical examination, you look for basic vital signs. Along with that, you see any marks on the body, any
Yes.
needle
Yes,
pricks on the arms or any other places on the body.
yes, ma'am.
And the change of behavior
It
in the and performance in the school,
No
at
proper
home,
eye contact,
no proper
taking
eye
a
contact.
movie.
Yeah. Child suddenly shifts into introvert behavior, doesn't want to communicate with the parents, etc. Yes. Yeah. So, yeah, that's what we were just understanding. Detection of these opioid poisoning among unconscious, patients also through thorough examination. Yes. So, what are the, ma'am? This is again one thing which we wish to understand. What are the immediate key considerations to be done in OP? As I try to, quoted few points like ABC to be taken care, IV core access to be started, any other, or any other points we need to be careful since this is nursing webinar and yes.
Okay, so I think along with any patient coming to the department, first thing, uh, it always start not only just a poisoning patient, anyone, airway,
Any
breathing,
fundamental
circulation is
things.
important. Those are the
Yes.
basics. Followed by as any there are few specific signs like respiratory depression, unconscious,
Yes.
pinpointed pupils.
Yes.
If you see that, you should keep in your mind it could be some opioid
Poison.
overdose,
Yes.
and make sure
Yeah.
as soon as possible get the naloxone and give immediately. And naloxone, as I've told, it's a beautiful drug. You will get a result as soon as possible.
Yes. As
Then,
and it acts only when the opiates is been
yes, it
consumed.
is there in the body.
Yeah, that is the charisma
Because
of
it is
the drug.
opioid antagonist, naloxone. So it
Yes.
acts only opioids when it is there in the body.
Yes.
Ma'am,
Yes.
ma'am, excuse me, ma'am. For all opioid drugs, is it antagonist, ma'am, or any other drug is there?
So it is opioid overdose. Along with that, you have naltrexone also.
Yeah.
Okay, ma'am.
There is
Okay.
another drug. But most
Okay,
commonly we use naloxone.
okay, ma'am.
And
Okay.
and
But
I
it,
as the Princy was asking, and this drug is being used as a maintenance treatment also, unless
Yes.
until
Yes.
the person recovers and as prescribed by the
yes,
consultant. Yes. Yeah. And yes, which age groups or conditions are associated? Conditions we have already discussed, and yes, now we are talking about the teens, early adults, and you have also told that elderly, the one who has no control on emotions, and few like they always feel like to feel high because it is high drugs and you feel elated and high. Yes. Any other anything else you would like to quote here, ma'am?
I think
PTSD
there is
also we
nothing
have a
specific in the
condition.
age group. So nowadays, if you
Yes.
see all the age group, especially the teenagers, why we say young adults and teenagers is they are people who are with stress. That is the reason they start with that morphine. Not
Yes.
in our India, but in the other
Other
places,
overseas,
they start
yes.
with morphine initially. So that's why they say
Yes.
it's young adults and teenagers.
Yes.
And yeah, chronic patients, pain patients who are cancer patients in severe chronic pain, either a patch, fentanyl patch, or they be with the oral medication, and post-traumatic stress disorders.
Yes.
Yes.
Okay. So, Princy, do you wish to ask your concerns since we are heading towards the time? Yes.
Yeah, ma'am. Ma'am, actually, we do have like cancer prevention awareness programs and awareness regarding alcohol and awareness regarding smoking. We are very prevalent and people are very aware of that. This is wrong. But opioid is there. I mean, using cocaine, using drugs, using this kind of awareness is there in our community. Are they starting? Are there in any other part of our state is there? I mean, in order to know the people about the programs, so that they can know about opioids and all. Are there any programs? Are there?
There is nothing, to be frank, there is nothing specific
Yes.
opioid related program which we are conducting. But nowadays, what we are doing, as per the emergency point of view, when we are training the BLS, there is something called first aid training. In first
Yes.
aid, we even make sure we add a slide on the poisoning. What is the
That's great.
importance of poisoning and importance of opioid poisoning? What need to be done? Awareness about the opioid indication, contraindication, and the uh, antagonist, that is naloxone.
Antagonist. Yes.
So we are making sure we are training them. So at least in this way, the most of the
Yes.
people, there is nothing specific awareness program on just on the opioid. But
Mhm.
yeah, it will be a good idea if we initiate. I think in a larger scale will be I mean, not possible now, but with a short
But
films,
yes.
short story, if we can share into the social media.
Yes.
Yeah.
yes,
So I
ma'am.
think with a small act
Ma'am,
regarding what exactly is the opioid, what happens when you take it. So if we do a short film or short story like that, I think it
yes,
will spread to the many of the people, and many of
yeah, ma'am.
people will be aware of that.
That is
I think we
good
can start.
idea,
Yes,
good
I
idea.
think a community-based awareness, as you rightly quoted,
Awareness.
yes,
Yes,
like a BLS, ACLS, nowadays the
yes,
awareness
yes,
is very strengthening. So yes, a very great insight about this. Yes,
ma'am.
Arundhati?
Yes, ma'am. I have a really great idea. So many movies and short movies are getting, madam, like an educated person, it's a focused. It should be a focus to the group who is and that short movies also. And also one more thing, madam, is very in like a first aid management. How we will do for dog bite and all. Madam, is it possible to introduce opioid? Management also and with the naloxone because naloxone has no side effects. I think so. Is it, madam? Shravani, madam?
You mean for any poisoning patient you are telling?
No,
Or only
ma'am. Only
opioids?
opioid, because it is a common, madam. It is, madam. So many, I'm come across that. Many people I heard about that. Those who are taking opioids and in teenagers and all professionals, madam, and not only students. Every profession also it is like a, madam, it's spreading like in the community, like so. At least we have to save their lives. So that
So
is the reason why it can be introduced.
you
It can
mean
be
to say
introduced.
yeah, just
See,
a minute, just a
yeah.
minute.
That
You
first aid
wish to
like
ask,
a first aid management, there's an Alexan management also can be introduced in this in the
Problem is the
first aid.
availability of the drug.
yes, yes.
Not so easy.
Okay.
And
If it is available, then yes.
then there will be short use in the market. You know,
Yes.
everything
Yeah,
will just
why
go
is,
into
ma'am, excuse me, ma'am, why I got, this doubt. Anyway, naloxone has no side effects, I think. And the general people, general doctors, anyone can advise, no, ma'am, this is this drug. So it is the near community who are working, the doctors in the community area. So if the available of the drug, it is there, means we can introduce and we can save the life of the people. Yes, ma'am? Am I right, ma'am?
Yes, definitely.
Yes, ma'am. Thank you, ma'am.
definitely. And is it available OTC or over the counter, ma'am? No, this is a
No.
prescription. This is a prescription
The
drugs. This is a
prescription is
controlled
not.
prescription drugs.
Yeah.
Otherwise, in
And
India, you might
and it is very short acting. So even though it
yes,
is useful to identify, if patient
yes,
comes with some unknown poisoning, to identify, it will be useful. But finally,
yes,
that patient requires the intubation, mechanical ventilator support,
yes,
and
yes,
infusion.
yeah.
And the dependency of drug is important in the hospital.
Yes.
Yes.
So, Arundathi, I think you might be experiencing many opioids substance users at your setup,
No,
or
ma'am.
I
I'm
mean,
listening.
among in the community. Yes. So, yes,
Yeah.
we have.
Community I'm working.
Yes. Thank you so much,
Ma'am,
everybody.
I'm basically MSc nursing, community health nursing only. So that I went to field, no, ma'am. That is the reason
That's
why.
all.
And I worked as a clinical psychologist also for 2 years. So that time I exposed and many people, those are using. Okay. Now
Using
they're.
this.
That's what, ma'am, I have wrote. I'm really glad to have this place to, ma'am, today.
Yeah.
Really,
And
I'm very happy to talk with you people.
yes. So we have come to the end of the session, ma'am, because and this opioid subject is very, very big. And within half an hour or 15 minutes, it is we are not going to just end the session, but yes, time demands for the same. And I'd like to thank you for your valuable time and very beautiful insight you have provided. I'd like to thank each and every speaker, Reshmi and Princy and Arundathi Garu. Yes, and we end the session. Thank you and stay tuned for the next interesting topic. Until then, bye.
Thank you.
Thank you.
Thank you.
Ma'am, thank you, ma'am.
Thank you.
Thank you.